Our last session is looking at using interprofessional teams effectively to care for patients who have serious illness. And I think, like the prior 3 sessions, we've got a very strong panel for you this afternoon. This panel is going to be moderated by Dr. JoAnne Reifsynder, who is the Chief Nursing Officer of Genesis Healthcare and has been there since July 2012, and she serves as its Executive Vice President of Clinical Operations also. She has held executive positions and leadership positions in both for-profit and not-for-profit healthcare systems, and more detail on her career path is in the book. You would also notice she's been a member of a number of nursing organizations and has been recognized by the American Academy of Nursing and inducted as a fellow in that organization. So I welcome JoAnne, a colleague and part of our committee, to come up and start off the next session.
Wonderful, thank you. So we're in the home stretch now, and what a wonderful day. Thanks so much to everyone. I was just commenting to Brenda in the break that we had planned a little differently for the setup of this workshop. Ordinarily, or we've taken it up as a practice to have a patient or a family member be interviewed and really set the tone for the day. And in this particular workshop, decided to do it a little bit differently. And you'll notice that lots of folks shared stories about their own experience as persons with serious illness or people who were themselves trying to find their way in a very difficult and not very systematic system. So if we need to be reminded, I was struck that healthcare is extremely personal and serious illness care is intensely personal. And we're all really looking for the same things. It's imperative that we continue to work together and break the boundaries so that we can really make some progress here. I noted too, Bryn, you said this morning that patients don't really name workforce as a source of suffering, and I agree with that. Certainly not at a macro level anyway, because when you're facing serious illness, your world becomes very compressed. But you do notice the caregivers who are present to you, who can be a source of your suffering, or by their absence contribute to your suffering, or also can be an enormous sense of relief and compassion. To that end, our organization has been doing a lot of work with the Schwartz Center for Compassionate Care. I'm sure many of you are familiar with that. And founded by Ken Schwartz, after he, at a very young age of 40, had a short illness with advanced lung cancer and died 10 months later, and then founded the Schwartz Center. And what he said about caregivers is that in his experience, he wrote about this in an article in the Boston Globe, had, for his family and for himself, made the unbearable bearable. And that's really what we're looking for our workforce to be able to do, and that's a tall order. So what we're going to talk about in this session is placed last by design, because this is really the integration of the principles and ideas and ideals that we've heard about all day. So I'm really delighted to facilitate this panel. I know you're going to appreciate these presentations, and then we'll have a chance to talk with them at the end. So we'll get started. Our first speaker is Sister M. Peter Lillian Di Maria, who's the director of the Avila Institute of Gerontology. Please join.